Doctors are keeping a very close eye on COVID-19 and flu vaccination rates. They're tracking a decline ahead of the holidays, which could mean a rough respiratory season ahead.
ABC Action News reporter Larissa Scott is in studio with us right now. She spoke with experts to find out the reason behind the drop. Larissa, what did you find out?
Hey, good morning, Deanna. Andrew. Well, doctors tell me that it's quite simple this time. The recent hurricanes have understandably put vaccines on the back burner, but the concern is now growing for a winter spike.
The past 2 months have been busy and stressful for people across Tampa Bay.
They're busy trying to survive post-hurricane for many of our folks. So they've been distracted from their own health in many cases.
Which means any concern for seasonal vaccines obviously went out the window.
I think, unfortunately, that means vaccination rates are kind of dropping off.
Doctors are especially concerned about the flu right now as we near the Thanksgiving holiday and the start of a busy travel season.
But between 40 and 60,000 people a year die of influenza. So getting the flu vaccine is something that we can use to protect ourselves a little bit from the severe cases.
That last year we hit an actual marker that we've never hit before, which was 200 children died of influenza. We've never had that many cases that high in the recorded history. 80% of them weren't vaccinated.
They're hoping now that a few weeks have passed since the hurricanes that people can start to shift their focus again to make vaccinations a priority before we get into the thick of respiratory season, especially for people who are more at risk.
The elderly and folks who have multiple morbidities, multiple diseases, or who are immunocompromised need to concern themselves with protect themselves from influenza for sure.
Doctors predict there's potential flu cases will start to skyrocket as we get closer to December and January.
Think about we need to really get those flu shots. It's really important before things get bad.
As for COVID-19, experts are having a hard time projecting what that spike could look like this time around. That's because a lot of people have some immunity from the late summer COVID surge.
We don't know really well how long that lasts.
And for anyone who wants extra protection, the CDC recommends waiting 3 months from your last COVID infection before getting the new booster. Doctors say you can get the COVID and flu shots at the same time.
The COVID shot may not prevent you from getting COVID, but it will prevent you from getting hospitalized. It will likely prevent the severity, and it will likely prevent long COVID. So there's good reasons to do both.
And doctors encourage anyone who's eligible to get vaccinated as soon as possible, preferably this week before the holidays.